Pardon? Louder? I did used to look at food labels very much, but since I've done the study for the league, I'm paying more attention. So why do we have food labeling? Well, it's a means of consumer protection. And we do have federal food labeling laws. A food label must include name of product, ingredient list, nutritional information, net quantity, allergy information, manufacturer, packer, distributor. And we have in the federal government the Food and Drug Administration. And that is the agency that has the job of ensuring the safety of our food supply. And the other organization is the U.S. Department of Agriculture. They're responsible for the meat and fish supply. They have to provide standards and also inspections. So we do have some federal laws. We had one that was done in 1990, another one in 2012. In 2004, we had a Food Allergy Labeling and Consumer Protection Act. Food labels of any food that contains a protein derived from foods that account for a majority of food allergies. Peanuts, soybeans, cow's milk, eggs, fish, shellfish, tree nuts, and wheat. So apparently there are over 100 food allergens, and the 8 covered in the mandatory labeling are responsible for 90% of food allergies. So we do have these laws. Well, we now know that obesity, heart disease, and diabetes are a few of the diseases associated with modern eating habits. So health professionals want to educate the public on their food choices and reduce confusion with regard to food labels. So we have all these nice laws. However, in 2006, the FDA commissioner reported that decades of inadequate funding and growing responsibility have resulted in its inability to keep up with scientific advances. For food labeling, the agency does not have enough well-trained scientists to meet regulatory responsibilities. There is a lack of adequate funding to provide manpower to inspect the many claims. Now, if you've looked at food labels, sometimes there are claims, sometimes there are health claims on a food item. But claims that describe the effect a substance has on the function of the body but doesn't mention a disease is not pre-reviewed or authorized by the FDA. Also, there are misleading ingredient claims. Sometimes, for example, you might look at a cereal box and it'll show you pictures of beautiful blueberries, and then when you open the box of cereal, you might see little blueberry bits that have been treated some strange way, and they don't really remind you of blueberries, but on the label, they show these beautiful blueberries. Well, the government really doesn't have, as I say, enough manpower or money to to investigate all these health claims. It's not there. Another labeling law that we do have is the country of origin labeling. We now have a growing global food market, as you know. So this requires retailers to provide their customers with information regarding the source, the country of certain foods. Also, we've all heard about irradiation, and apparently it's been used for more than 30 years. I was surprised at the number 30, to improve food safety by reducing or eliminating insects and microorganisms. So the FDA and the USDA have endorsed the safety of irradiated foods, and the FDA requires the use of the International Food Irradiation symbol on a label. So we have that for irradiation.
What's this symbol?
Yes,
so we can avoid it.
Has anybody ever noticed that?
Is
Yeah, there's a symbol. We just all don't know it, and we don't know what
We
it
don't
looks like.
know it now. Well, a lot of us like to buy organic food now. So as an official marketing term, it's new. It went into effect in 2001. The USDA has sole authority for the certification, compliance, and enforcement of the National Organic Program. So what do they say? Synthetic fertilizers, sewage sludge, irradiation, and genetic engineering may not be used. All operations throughout the food system with more than $5,000 in annual organic sales must be certified. So that's the organic food law. By the way, Anne will be speaking a lot more about genetically engineered, what that means. I'm just mentioning it here, but she will go into that because that is a very big issue these days. A number of public interest groups are pushing for new labeling legislation, better labeling legislation. For example, to go back to genetically engineered foods, in the U.S. a level of 1% genetically engineered content is commonly recommended for labeling these foods. Levels range from 0.99 in the European Union to 5% in Japan. So at the state level, about 30 states have movements to put mandatory labeling of genetically engineered foods to a vote of the people. And I think 3 states already have the law. Vermont, Connecticut, and Maine passed mandatory labeling for GE foods.
Vermont is suing.
Yes,
They're suing Vermont.
California
Senator
turned it
has
down.
filed a lawsuit against Vermont. So we all need to watch with bated breath because we'll see what happens.
Actually,
California voted it down.
voted it down.
Voted it down. That was a couple of years
Well,
ago.
we'll go into this a lot more, but Chris sent me an interesting email. Apparently in the Senate at the moment, there's a bill which would make mandatory labeling of genetically engineered salmon a law. So that's hasn't been passed. It's a bill, but as far as I know, it's still in the Senate. Another thing that I found very interesting, and I was discussing it with some people here, when I first started reading about genetically engineered, I thought that very, very few items in the grocery store were genetically engineered. But the League says with the percentage of items that contain genetically engineered ingredients in a grocery store ranging from 60 to 70%, it may be more effective to label those foods that do not have 60 to 70%.
Anywhere in this report, does it explain what the damage, what the problem is for us to eat these things?
Well, you know what, Anne, Anne is going to go into
great.
that. Unfortunately,
Okay.
my part was before, and I'm just mentioning it, but she will go into that, yeah. So, there are public interest groups. They want better rulemaking and enforcement on food labels, and they say accuracy in food labels is a very low priority for the FDA. Consumer groups, health industry, agriculture groups are putting pressure on the FDA and state legislatures to bring a less confusing labeling system to the public. Again, the FDA lacks legal authority to compel companies to provide information about their claims, and the FDA's oversight and enforcement efforts have not kept up with the growing number of food items. So that's it for food labeling. Look at your labels.